are.
All right, welcome to Modern
Okay.
Nurse Fest. We have the crew from the Trusted Canon Nurse. I'll let them introduce themselves, but today they are sharing some awesome knowledge about microdosing for nurses, which is huge, and every nurse can actually benefit from microdosing potentially, depending on what and who you are and what you need out of microdosing. So they're going to present an awesome program that any nurse can join and just learn the awesome benefits that come along with microdosing. So thank you for being here, the Trusted Canon Nurse. Ladies, I'll let you take it away.
Okay. All right. Thank you, Emily. Okay. Can people see my screen and hear me? Yes.
Yes.
Okay. Awesome. 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 Okay. So let's just start with a small introduction on who we are and what we do. This presentation is called Shift Change, Microdosing for Nurses Healing from Burnout. So excited to be here. Here's a little bit about Trusted Canon Nurse. I started this 2.5 years ago as a means to bridge the gap between patients and cannabis as medicine. And in doing that work, I realized that most people have a lot of trauma and their chronic illness is coming from their history of trauma. And while cannabis is fantastic for some symptoms of chronic illness and PTSD, the magic healing is really in the psychedelics. So that's when I brought Ariane on board because she is specially trained in psychedelics. She guided me on my own microdosing journey a year and a half ago now and has been absolutely life-changing. And then I brought her on so that she could guide our clients and our patients on their microdosing journey. And then our team has grown since then. We also have a pediatric care specialist who helps our pediatric patients with CBD and cannabis, the ones with autism, epilepsy, cancer. And then we have a pharmacist who helps us with our medication interactions. And then he also makes our suppositories. So on top of the cannabis and CBD guidance and education and microdosing programs that we offer, we also have really high quality CBD products. And I just want to speak a little bit about those. So we have tinctures, edibles, topicals, suppositories. Some highlights about our tinctures is that they are whole plant, full spectrum. Yes, all of them have a small amount of THC in them. And we partnered with a former NFL player last year for a formulation specifically for people with head injuries. This is something that I will use on my kids as well as, teenagers with head injuries and of course adults too. We also have edibles, wonderful topicals. We have suppositories as well, and we did a market research study on our suppositories this year, and the outcomes of that were phenomenal. We tested them on 103 women. 94% of them said that they were effective in reducing their period-related pain and cramps, which is so cool. That there is no pharmaceutical that performs that well. Our products are also physician recommended and available nationwide for people to purchase online at trustedcanonnurse.com. Okay, without further ado, let's get into psilocybin and microdosing. So, let me see here. Okay, yeah. So a little bit of historical context, because I think that's really important. This is historically indigenous medicine, and we need to understand a little bit about the historical context of it. So just like cannabis, it has been used by indigenous people for millennia. Psilocybin has been used by peoples of Mexico, Australia, Siberia, Greece, Egypt, and Africa. In 1955, this white dude went down to Mexico in search of a magic mushroom experience, and he met Maria Sabina. And he had this journey with Maria Sabina pictured here. And then he came home and then he sent a sample to Albert Hoffman, who was this scientist in Sweden, I believe it was, who was doing his work on LSD. And then from there, they were able to isolate psilocin and psilocybin from the mushroom itself. And then they did what Europeans do with Big Pharma, and they synthesized it, they isolated it and synthesized it, and actually made a medication from it. And that was prescribed during some clinical research at that time. Also, when Gordon Wasson came back from Mexico, his news story was splashed all over the papers nationwide. So then, Americans went down to meet Maria Sabina and kind of did what Americans do. And we kind of westernized psilocybin medicine and made it, maybe Ariane can speak a little bit more to the historical context, but it was not good. Maria Sabina was an indigenous woman, and she did amazing work with medicine, and then we kind of went down and ruined a lot of that for her and her culture. So it's a little bit sad how that worked. But in the 60s, there were lots of cancer trials, treating patients for their existential crisis at the end of life. And then in 1970, it became Schedule 1, which means no accepted medical use and high potential for abuse, both of which psilocybin does not meet. We'll explore that in a minute. And then in June of last year, the FDA did draft guidance for clinical trials of psychedelics. So we are seeing more and more clinical trials on psilocybin and other psychedelics as well. Okay, what is psilocybin? So it is a genus of mushrooms. It's a fungus, and there are over 180 species. We work with just a couple of different varieties. So it can be, and it's mostly ingested whole, like we aren't synthesizing it or isolating it. We are grinding up the entire mushroom or putting the whole mushroom in a tea and eating that raw or in a capsule. So they have, you have like a gram of mushrooms. Pictured here could be about a gram. And that has, depending on how it tests out, maybe 6 to 10 milligrams of psilocybin in it. That is the active ingredient in the magic mushrooms is the psilocybin. So it's kind of like cannabis, how you have a gram or an ounce of cannabis and it tests out at 22% THC. That means it has 22 milligrams of THC in that gram. Here's a little bit about the legality. This may not be completely updated. I don't know if anything has changed in the last year. So it's still federally illegal, but Oregon and Washington, D.C. have fully decriminalized. There are other decrimmed cities throughout the country. So DC is one of them. Our lawmakers have access to this medicine, and most of the rest of the country does not. In January of last year, the NIH established a psychedelic interest group. So of course, they're doing studies on it. And I just checked last night, and there are 194 active psilocybin studies going on throughout the world. And that's just the ones posted on clinicaltrials.gov. Not all research studies are posted on there. Okay, how does it work in the brain? I need to move these. There we go. I had to move those out of my way. Okay, so when we ingest the psilocybin in the mushrooms, it converts to psilocin in the liver. And it is this psilocin that acts as a serotonin supplement, and it binds directly to one of our serotonin receptors. Binds to a few of them, but it binds mostly to the 5-HT2A serotonin receptor. And depending on how much you take, that effect can go from a subperceptual, maybe you don't feel it, maybe you start to feel a little bit of it, to like full on visuals, having a journey experience, otherwise known as a trip. So these serotonin receptors are responsible for smooth muscle contractility. They're responsible for memory and learning, oxytocin release. To put it in the context of nurse speak and and medications, Haldol and Trazodone act opposite of psilocin at these receptors. So Haldol and Trazodone block these receptors, which is also important to know. People on these medications oftentimes may need higher doses because they block those receptors. What else did I want to say about this? It'll come back to me. So it also binds to our TKRB receptor, and that is the BDNF, brain-derived neurotrophic factor. That's a protein that we make, and that is responsible for has responsibility in mood and memory and learning and neuroplasticity. So it binds to this receptor 1,000 times stronger than most antidepressants, which is why a big reason why psilocybin has an immediate effect and antidepressants take 6 weeks to work is because of the strong binding power at this TKRB receptor. And I remember what I wanted to say, that antidepressants work by sort of, blocking the reuptake of our own serotonin to hopefully enhance our serotonin. This acts as a serotonin supplement. So it binds directly to those receptors, just like our own serotonin does. And then, like I said, it enhances neuronal connection and neuroplasticity, meaning we can reshape the way that we think and create new thought patterns around certain ideas that we have. And we're going to get into that. And antidepressants don't work that way. So there's a ton of research on psychedelics in general, and lots of research support them for the treatment of OCD, anxiety, depression, eating disorders, PTSD, cluster headaches, addiction, physical pain, plus many, many more things. There aren't a whole lot of ailments out there that some degree of psychedelics may be supportive for. They were even doing research on LSD and autism in the 60s. And I really hope to see more of that research come back. They were giving LSD to children with autism decades ago, and the outcomes were really, really cool. All right, this is just one of the many studies, and this compared psilocybin to Lexapro. So the graph on the left, we are looking at depression scores, the BDI, that's the something depression index. So they gave this is a macro dose, 25 milligrams of pure psilocybin that they gave. I think they gave it on 2 different occasions. So, and then they gave like the standard dose of Lexapro. I don't remember that dosing. But as you can see, over time, the depression scores dropped. First of all, they dropped much faster in the orange psilocybin group than the Lexapro group. And then those scores kept going lower throughout the 6 weeks. And then if you look at the Lexapro group, dropped a little bit more, and then went back up after 6 weeks. So this just kind of compares the efficacy of psilocybin to Lexapro. And again, this is 2 doses of psilocybin versus daily Lexapro. And then on the right, it's been a while since I've dug into this study, but they're looking at brain modularity and the default mode network. This is basically the connections that are in our brain that are more solid than others. So what they found was psilocybin made it possible to make new connections in the brain. The default mode network is the stories that we tell ourselves, A plus B equals C, always, always, always. That's like we're going down ski slopes and we have our skis in the tracks, right? And what psilocybin does is it kind of lays down a new layer of snow for us to be able to make new tracks. And that's a little bit about what this is measuring, is that the default mode network went down, meaning the brain was able to create new connections, which is so freaking cool because other pharmaceuticals don't do that. This is my favorite because this really puts into context that a lot of what we were taught about these medicines is false. And what our government is telling us about these medicines is false. So let me orient you to this graph a little bit. The up and down is the dependence or addiction potential of these drugs. The left to right is the lethality. So in the upper right, the drugs carry highest risk for lethal overdose and addiction or dependence. The ones in the lower left carry virtually no risk of lethal overdose or dependence. So meaning you can't really become addicted to LSD or psilocybin or lethally overdose. Like the amount of mushrooms you would actually have to eat is physically impossible to lethally overdose on it. And then cannabis, as we know, less than 1 in 10 people do have a dependence issue with cannabis. We know that. Other drugs that are sold over the counter or at gas stations that are more dangerous than these Schedule 1 substances, alcohol, nicotine, and caffeine. And then meanwhile, other psychedelics such as MDMA, ketamine, and mescaline are technically, in a way, safer than drugs and substances that we can get at a gas station. So seeing this really flipped everything I knew on its head, and I love showing this graph to people. And I am going to let Ariane take it from there to talk about microdosing.
Amazing. Yeah. Thanks. It's excited to be here today. So can y'all hear me okay?
Yeah, Ariane, I didn't really introduce you.
Yeah.
You want to introduce yourself?
Yeah, sure. I hope that y'all can hear me and there's not a whole lot of background noise. Um, my name is Ariane. I've been working with Megan for about a year and a half now. I've been working in the cannabis space with people for, I think, 4 years, and I've been working in the microdosing space for about 3. And like Megan said, when we started working together, I was actually her microdosing coach to get this all started. So it's been a really beautiful, fun adventure to kind of see the shifts that she's made just from incorporating this tool into her life. Microdosing, it's interesting because it, for me, and it is a way of us getting to know ourselves a little bit better, when the critical voice kind of quiets down and we can kind of just be curious in this moment, right? And see how we want to show up with it. And microdosing can really help with that. So, what is it? Microdosing is taking a very small amount of, um, psilocybin or LSD, even cannabis. Like you can microdose cannabis as well. And just taking small amounts of any of these substances where it's like you kind of feel it, but not really. And with microdosing, if you notice anything, it's often a change in your mood. Some people will feel calmer, some people will feel happier, some people will feel more motivated, things like that come on board. But at no point in time is it something where you should feel altered or like see, the wall melting or anything like that, or should your phone look weird or you're seeing things that aren't there. That's not what it's like to microdose. And it's also not something that has to be done every day to get results. Some people do it 3 days a week, some people do it 4. There's a couple of people who do it 5 days a week, maybe Monday through Friday. But it's not something that has to be done every day in order for there to be benefit gained from it. At least that's what I've seen over the past few years, which I think is really beautiful as well. Microdosing, it says here like a microdose starts at 0.5, but we've had some people that like even that might be a little too much. So it could be even less than that. But a microdose experience when I work with people is really kind of like, don't look at the dose as much as like what you're experiencing. Are you noticing something? Like one of the things I think it's kind of a misperception. It's like, well, you shouldn't feel anything when you're microdosing, right? And that's not really true. I mean, if you don't feel anything, it doesn't mean that you're not gaining benefit. But I don't think you've hit your therapeutic sweet spot just yet. Like you should be noticing something at some point in time where you're like, oh, okay. And sometimes it takes a little bit of time to find it, but either way. Then macro doses, which is where you are going into a deeper psychedelic experience where maybe you'll see sacred geometry, maybe you close your eyes and you're seeing a really beautiful image in that way. But that's definitely higher up. So there's a difference between doing a microdose, which is just a little bit, and the one that like where you're crossing the veil and seeing God. What's next? Yeah, we're talking about the difference between a micro and a macro. It really is like the dose makes a difference, right? Um, Microdosing is subtle. So for some people, I kind of share that what is the experience like? It's like, okay, well, if you're going to the gym and you're like working on a specific goal, you might not be seeing a whole lot of results, but maybe you run into somebody and they're like, wow, you look different. What are you doing? You're like, oh, maybe I do look different. And you start looking at it in that way. And that's kind of what microdosing is. It can be very subtle. I've seen with clients and patients that their families are actually the ones that are like, what's going on with you? There's something different. And they're like, what are you talking about? Because they haven't disclosed that they're microdosing or whatever. So that's kind of what happens where like a macro dose, um, it's one of those like wakes you up kind of moment sometimes for some people where they can go in really deep, have these like deep aha, like earth shattering, like, oh wow, this is what it is. This is what it means. This is what X, Y, and Z. Like there's a huge perspective shift. And like one of the examples is like someone who like comes into being a parent for the first time. And it's like, as soon as you find out, and it's like, oh, everything changes, right? I have this new information and everything in my life is going to change. That's kind of what it's like for some people when they do a macrodose experience, being able to really get deep clarity on some things that they may be hung up around or whatever. Where microdosing is a little bit more subtle, and you can do some of the like finessing and some of the deeper work with things, but it's not going to be like holy cow, unless it is. I mean, I'm not saying you can't have a deep perspective shift with microdosing, because we have people who use this in conjunction with different therapies. We have therapists that are recommending their clients and their patients to work with us because this helps them get into a deep, like a different space, helps them relax a little bit more so that they can really get clarity and make the shifts that they are wanting to make. So yeah, facilitation and integration are recommended for both. And yeah, we'll talk about that too. So why do we think this can be helpful for microdosing for nurses, like outside of me and Megan, both being nurses and working through different things, but like burnout is real. Caregiver fatigue is real, and oftentimes we don't even give ourselves enough space to pee. And we don't know how to take care of ourselves. And I really do believe that microdosing is a way for people to kind of come back home to what's important so that they can start filling their own cup and pause. But it can help with motivation. It can decrease anxiety, kind of quiet the mind down. It can really help bring back joy. It can help bring connection, like with family, where you just want to be around your family, right? Maybe not so isolated, because nursing and some of the heaviness that it carries, like it can be isolating when our family doesn't really understand what we're going through or how to support us in that. And it's just like it'd be easier to be alone. But this really gives an invitation of like, I do want to just hang out with my family and watch a movie and just be relaxed. Or maybe you're the nurse that's so hyper vigilant because you're so stressed and wired from work that you can't even sit down and enjoy a movie with your family because you're like micromanaging everything in your environment, right? Microdosing can help kind of bring that down. We've also seen it where it decreases alcohol consumption. And, it's making, I mean, it's not really a joke, but I mean, in a way, I was talking to someone the other day. I said, I feel like as soon as you get that nursing degree, it's like almost like here's a prescription for anxiety and here is an alcohol dependency. Like they just go together, and it's like it's a toxic culture where it's like so acceptable to just like drown your woes in alcohol constantly. And this is something that happens with a lot of nurses, a lot of caregivers, and there's no shame around it. But what we've seen is that when people start microdosing, is the desire to consume alcohol actually decreases because they're not needing to check out or all the things because they're so hardwired from their nervous system, like their nervous system is starting to regulate. And that is one of the benefits. And what Megan was talking about earlier, like this is supplemental to our nervous system. It can help bring it down into a space of calm and regulation so we don't feel so stuck or stressed out and stuff. And then getting unstuck if people are feeling unmotivated, like it does help with that. And just like I said, it's interesting when we work with people in a deeper capacity with it and really understanding there is an invitation of like mindfulness based practices and what are ways that you can fill your cup and take time to pause really and get back to grounding so you can do what you love. That was nice. Oh yeah, so microdosing facts. Microdoses are not meant to impair you, like I was talking about earlier. Like it isn't anything that should be super heavy. We've worked with multiple nurses. Some of them choose to dose on days that they work. Some of them choose not to. That is completely a personal choice. You know, like a good nurse, we always recommend that whenever you start something new, you do it on a day off. Don't drive until you know how things affect you. But really just start it on a day off to see how you feel. As far as it is right now, this is not, the metabolites for it are not tested on any 10 panel drug screen, and that's including for like the Department of Transportation. So it's just not being screened for right now. It's specialty testing. I'd be curious how quickly they would have to test for it anyways, because psilocybin has a half-life of 3 hours and it's water soluble. So it's out of our systems like really quick. But the effects kind of linger along. Yeah, unlike other substances, microdoses carry virtually no risk of addiction or dependency. In fact, it has been shown to be supportive for overcoming many things. And that is a big question that I get, especially for people who are recovering alcoholics or have other types of dependency issues, is a concern. But this doesn't interact with dopamine, which is one of the benefits as far as it's not going to be hitting that reward. So it's not something your body is like, oh, I need it. You know, it's nothing like that. You're not feeling altered. So it's not something to necessarily escape into. And microdosing quite literally induces mindfulness. Like that's what it does, presence and awareness. And the invitation that I try to bring is the non-judgmental part, which is something that psilocybin can do because it quiets that critical voice so that we can have a little bit more self-compassion. So I've never even seen over the past 3 years with people using it like mindfully, intentionally, only a few days a week, you know, taking regular breaks. I've never even seen anybody have withdrawal. Unexpected outcomes. So I'll share like there is this stuff like we've had people with long COVID that get their smell back or their chronic fatigue. That was actually kind of surprising. Women whose PMDD is shifting, where it's not where they're not wanting to kill the whole world, you know, week, 2 weeks leading up to their cycle. But I've also seen some people who have short periods of like 19-day cycles that extend to a 24, 25-day cycle. And that's one of the things that's really interesting is that stress affects progesterone. And if you're super stressed, then your progesterone is going to be low, and that can lead to a low cycle. So if you can get your stress managed, I don't think that this stuff is having a direct interplay per se on our hormones as far as that goes, but I do think that it's influencing it in some way. And I think it has to do with our stress and decreasing it and regulating our nervous system, because there's been some reports of people with endometriosis getting relief from pain, but also chronic pain, specifically like nerve type pains, nerve damage type shooting pains. We've seen that increase in sex drive with dementia. What we have experienced and seen is that it's not so much that people are like getting their memory back, right? But that they're not isolating and they are able to engage. And that's one of the things with dementia, that it can create isolation because you can't engage in conversation. You can't follow, like things don't make as much sense. But what we've seen is that there's been an incredible improvement in just quality of life when incorporating this in, where people are just happier. And we have one client, our oldest client is 89, and his chronic knee pain that he's had for years is gone. And they were doing injections in his knees once a year. That was like $1,800 injections. And he's like, there's absolutely no need for it at this point because he's doing great. And then the decreased desire for alcohol and cannabis and other substances. And on this slide, I kind of wanted to talk about, like, as far as it goes with nurses, like kind of circling back around, I'll share a case study of one that we worked with. And this nurse has been a practicing nurse for like 30 years, and had been trying to come off of an antidepressant and was really, really struggling with it. And that was part of the reason why they were exploring doing these other things. And not only like when they started microdosing, they were able to come off their antidepressant without any withdrawal, which we don't provide titration schedules. What we do is we help people regulate their nervous system whenever they're coming off of antidepressants, which is something that physicians aren't taught how to do, not even with the basic nutrition. But I digress. So that's kind of where we fill in the gaps. And this person was able to, and she was like microdosing her Lexapro because her withdrawals were so bad. She was able to completely come off of Lexapro with no withdrawal. She's been off of her antidepressant now for almost a year with no rebound depression. She has also been able to lose weight because she's created a different relationship with her body, because she's no longer drinking alcohol or craving junk food when she gets off of work in the afternoons anymore, because she has like been able to create a different mental environment, which is creating a different physical reality for her. And it's been really beautiful to witness. She shared a story with me that she works in a critical care unit, and they were really busy, short staffed, and had like multiple admissions that were coming in. And she said that she just excused herself for 5 minutes and went and did some breath work, just easeful breathing that we talk to people about, to get back into the body and back grounded. And she was able to go back on the floor and do all the things that she needed to do, take care of each one of her patients to her highest ability. And she said when she clocked out that night, she felt complete, that she wasn't carrying anything with her. Like, she knew that she did the best that she could, and she gave all that she was, and she felt complete with that when she checked out for the day, right? And she didn't go home and binge out on Cheetos and half a bottle of wine, because she felt regulated and okay, and just knew that she did the best she could. So um yeah, it's really, really beautiful to kind of see these stories happen for some of these people. So, there's risk and considerations that need to be taken into consideration with anything that we do. And as much as I believe that psychedelics and plant medicine can change the world, like, there's a time and place for it for each person. When there is a significant psychosis or mental history, things like multiple personality disorders and stuff like that, like, it probably not appropriate. Schizophrenia, probably not appropriate, at least not for what we do, right? I'm sure that there's a psychiatrist or psychologist out there that is well set for that, but there's a lot to be taken into consideration, because we don't want to induce something or do something that is going to induce further destabilization, because even in microdosing, you can have destabilization or emotional turbulence that comes up, because this stuff isn't emotionally blunting, which is very different than antidepressants, where it can make you feel numb. Even though this can increase your emotional resilience and your emotional response, it is not emotionally blunting. So it's not going to keep you from feeling. And it's also not just like this happy medicine either. So if there's, what I tell people is like, the caveat is, let's just say there's been a boundary violation or something you've been ignoring, and you're just like, whatever. And you're just like, I don't care. And then you start microdosing and you realize that you really do care. Right. And you're starting to get angry and frustrated and irritated. And I've had people say, like, I don't think it's working. And I was like, oh, I think it's working. I think it's working just the way that it's supposed to work. Like, can you be curious enough with why you're feeling the way that you're feeling so that you can get resolution around it? But again, this is like, it's not appropriate for everybody. Like, people who aren't ready to like really kind of fill into those other spaces, we have other tools for that to help you feel safe in that, so that you can be open to this at some point. Recent mental hospitalization, actively feeling suicidal or anything like that, like, this is not appropriate. If there's someone or a family member that is experiencing that, like, and they're looking into doing things, ketamine would be the place to go for that. Um, Ketamine has been shown to like be able to pull people out of suicidal ideations very quickly. Um, Pregnancy or breastfeeding, and that is something else that we don't have a lot of information. We know that there isn't, from what we know right now, it is water soluble, but there isn't a whole lot that is necessarily crossing in the degree that what we think it would be. But when we're looking at someone who's breastfeeding or pregnant and being put on a antidepressant that can cause fetal malformations or issues. Personal empowerment and choice and education is really what comes in for those types of things. Medical history of high blood pressure, any liver, kidney diseases, anything that's like really cardiac, because THC, I mean, not THC, psilocybin works on our serotonergic system. Our serotonergic system goes throughout our body, including our heart. So there is this transient hypertension that can happen. I don't see it so much with microdosing, but I have seen it with microdosing when people start doing it and then their blood pressure increases. So it's just one of those things, especially if you're not well managed, it might not be appropriate, or having any other types of like strenuous cardiac or stroke histories and stuff like that. So the question that a lot of people have is like, what if I'm on meds, right? Can I do this if I'm taking other things? And the answer is maybe. Maybe. It really just depends on what it is. There is a competition at the receptor site with a lot of antidepressants with psilocybin. And sometimes if it's just like one antidepressant, then maybe we can, do a higher dose of psilocybin to kind of see if we can get something in there. The risk of serotonin syndrome is incredibly low as long as we're thinking about what we're working with, right? If it's one antidepressant, if it's Lexapro or Celexa or something like that, even Wellbutrin, like, okay. But when we're starting to talk about multiple polypharmacy psych, it's kind of going back into that other picture of like looking at the mental health and is this appropriate? Is this appropriate right now? Are there other interventions that we can do? Because there's one case study that was released, and the person, I don't remember all the meds. I do remember trazodone was one of them. And there was an SSRI and maybe a mood stabilizer that was on board. This person started microdosing, and after like a week or two, they developed serotonin syndrome. So none of this stuff is necessarily benign, but in my experience and what I've seen with people who are choosing to explore this while microdosing is, or while being on antidepressants, is that it's relatively like benign if we're going to be doing it with just one. But it's also knowing that it could completely block it. I have seen one antidepressant that completely blocks psilocybin experience like 100%. So, and like Megan has said, trazodone will kill it. Xanax, Valium, those things will like completely like close shop. Those are known as trip killers, period. And strategic dosing can kind of help with that. And then the recent or current spiritual emergency, like really checking in. And there's a lot of other things to take into consideration, like home, like is someone in a stable home where they can feel safe? Because even though this is microdosing, being supported in it is important. So yeah, and this is something we love to do, is support nurses and others and caregivers and stuff like that in a couple of capacities. We have a 8-week program that is a group that is starting at the end of this month. And the intention of this is to bring a group of nurses together to explore the use of microdosing psilocybin in ways of just helping with burnout or helping feel stuck, or wanting to like come back into feeling like yourself again or feeling that joy again. We're going to have an 8-week program, and during the process we'll also talk about the foundations of health. That yeah, microdosing is great, but the integration part of it is really important as well, which is like following through with the foundations of health. That for some people, like, are we eating the way we should? Are we moving our bodies? Like, what does the sleep look like? And what can we do to really make ourselves feel like we're thriving? So do you have anything else you want to share on that, Megan?
Yeah. Oh, let me go. It's not letting me go back. That's being weird. Okay. Yeah, we're so excited to offer this microdosing program just for nurses. And the special part about it, we missed the slide on the integration. I'm going to forward because we have other slides here. On integration, and that's what makes psilocybin much different. Oh, it's not here than like a pill that you pop and go about your day. It's like the integration, and it's talking about the changes that you're noticing. And Ariane, if you want to speak a little bit more to integration, or we're running a little bit short on time, but integration is so important in this medicine and this work. And I don't know why I can't go backwards. There we go.
Yeah, that's a part of this, like, too, when I talk to people about the differences between an antidepressant and psilocybin. It's like antidepressants are like passive coping. They help you like weather the storm. I mean, oftentimes if you go into your doctor's office and you're like, I'm feeling sad, you know, they're going to start an antidepressant. They're not going to ask you if you're doing therapy too, or they're not going to recommend therapy first. But it's kind of like a passive, like weather the storm, just get me through it, where microdosing is more of an active form of coping, right? And you are in this increased state of neuroplasticity. So if you can start integrating some of these things that feel good for you back into your life while you're in this state of heightened neuroplasticity, then these new behaviors, patterns, and like rituals and stuff like that start becoming sustaining, right? Where they start becoming part of who you are and what you want to be, versus where I mean, versus if you're not doing the things, right? It just makes it easier. It's interesting how people like start feeling more motivated, and then some of these mindfulness based practices, because they are so much more present and aware, just naturally start falling back in line. So I'm not going to say it's effortless, like having a game plan to set yourself up for success, like to know what is going to support your integration process, be like journaling, or, you know, I really want to do this differently. And like I want to start moving my body. I want to cut down on the amount of cannabis that I use. And it's like, how can you start setting yourself up for success, right? How can we work together with this? Because it likes to co-create, right? It likes to be there with you in it. Will it work on its own? Yeah, it can. It can do some cool things. And it really likes it when we do it together. So that's been my experience with it.
Yeah. Yeah. And group integration is amazing because you get to reflect on your experience and then the experience of others. Like some things, some small shifts, you might be like, okay, this happened. Is it placebo? Did this really change? But then like 3 other people in the group are experiencing that same change, which
Right.
is like really like that's such a key part about the group. And with this group, we'll also have like a group chat on the side. We'll meet once or twice a week. And then we have this group chat on the side for people to ask their questions in real time and get their answers and share their experience. So it's really cool. And it's normally $4.99. We are giving participants here $100 off. You just go to trustedcannabisnurse.com, and right at the top, there's the banner for the info page. You book a discovery call, talk it through with Ariane to see if it's appropriate for you, and then get enrolled in the program. And then supplements will be sent, and as well as a journal too. And then we start the meetings. And
Yes.
that, unless there's anything else, Ariane, yeah, please feel free to follow me on. I put out educational content all the time. Some of it can be entertaining. All right, with that, I want to open it up to questions. I'm going to stop share. Okay. And were there any questions in the chat? I have not been following the chat.
No, I don't think.
Okay, okay.
Yeah. Alicia was saying that she's had much more long lasting shifts with doing microdosing than with macros. Yeah, I mean, I think a part of it really, Lacey, is like the integration, like the continuous integration that's happening with it, which I think fall off after a macrodose. Um, People on antidepressants and anti-anxiety, it really just depends. Like it depends on the frequency of it. You know, if someone's going to take an anti anxiety medicine, like the invitation is to like not take it at the same time, because often those things are like it's going to stop the effects of the psilocybin. It really just depends on what they are. and like I've had people who take Buspar and Wellbutrin and they're still able to microdose, right? It's just being strategic and trying to not do it at the exact same time. Um, and that's a lot of it, is because there's a lot that's unknown. A lot of the education that I have, I mean, I've done education and training in a variety of things for psychedelics, but the biggest pharmacological resource has been Malcolm, at the Spirit Pharmacist. Like, man is legit, knows what he's talking about, and is a great guide. And that's like, I use his wisdom to kind of help lead and share with our patients. Any allergic reactions seen during microdosing? So I haven't seen any allergic reactions. What I have seen occur for some people is in the first like week or two, some people will have like loose stool, or I've seen some people who have constipation. And again, like serotonergic system, right? So it's like, this isn't too much of a surprise, but these are some of the things that I've seen for people. I've seen some people who have said that their headaches were actually more pronounced, like they started having headaches, but that was also self-limiting. So anything that I've seen as like a less than ideal side effect has been resolving, like self-resolves on its own within the week or two. And I think some of it is like the body acclimating to bringing this on board. But I haven't seen anybody who's had any type of allergic reaction per se, at least not where I've seen. I'm sure it's possible. Yeah. Yeah, you're welcome. Yeah, I mean, overall, y'all, like for real, it's like I tell people it's kind of an underwhelming experience. Like people get like they're all like nervous, and there's all like this anticipation. Like I don't want to call it fear, but there can be fear too, right? And then they start doing it, they're like, okay, this isn't what I expected. I was like, I know you're expecting to trip. You're not gonna feel high. Sorry.
Yeah.
Not for microdosing, but any issues with gut issues? Yeah. So I mean, like I said, I have seen some people who have developed constipation, but hydration, increasing fiber intake, and it usually is self-limiting. I've had some people who have had diarrhea, but again, like it's self-limiting and it's something that usually goes away on its own. And I think it's just the body adjusting. I haven't seen anything that has been exacerbated with it, especially if it's something that is like anxious stomach. If anything, I see there's resolution with that. Yeah, I haven't seen anything with gluten intolerance either. There isn't any gluten in mushrooms. I do believe they're gluten free, and we're not working with the mycelium, right? We're just working with the dry fruiting body. So gluten intolerance and stuff like that, that's where I would kind of, if you're buying supplements, mushroom supplements, like maybe want to pay attention to, is it like grain-based mycelium? And then you might have some gluten issues, but we're working with the mushroom and there isn't any gluten issues with that.
One really cool thing that about the mushrooms is like there was a study done where they isolated the psilocybin and then in one group, and then they gave the whole mushroom psilocybin in the other group, and like the whole mushroom performed better than the isolated psilocybin. And we're going to see eventually, we're going to see an isolated psilocybin pharmaceutical from Pfizer or whatever. But the whole plant mushroom will always outperform that, just like we see with cannabis, that
Yeah.
the whole plant is going to outperform. And it's more gentle on our body too, because you have like the whole plant with it. And yeah, raw is amazing. Some people don't like the taste. I am one of those that I gag even just smelling it. So I can't tolerate the taste, but I know that it's like so beneficial and so wonderful. So I prefer the capsules, and then I have ways around. If I'm doing a larger macro dose, I have ways to get around the taste. So
Is this something you have to take forever, or you can stop when you want? Yeah. So the intention behind it is not to have to take it forever, right? Because we're increasing our neuroplasticity and we're changing behaviors and stuff. These things that happen, or the changes that we're making while we're microdosing, can be sustaining. right? So this isn't meant to be something that is long term. And it's not something that's done every day. And I encourage people to take regular breaks, no different than if it was with cannabis, because as it is right now, we don't know what the long-term effects of microdosing is. There was a paper that was released a couple of years ago by Harvard about there being possibility of psilocybin hardening the heart wall valves because it works similarly on the heart or has similar mechanism of action as a cardiac med that holds that risk. And again, like we have a serotonergic system in our heart. So like, yeah, these are things to be mindful of. But I feel like if we were going to see something like that, we would already see it with the fruiting body, right? Where I think that we're going to have problems is with the synthetic. Maybe we'll see more of that, like with the synthetic, but also regular use, right? So if someone is going to be taking it every day for long term, you're probably going to have withdrawal. You're probably going to have to taper down in order to not have a complete drop in serotonin because your body may get lazy and stop making it. And I think that that is where people are going to start having issues with withdrawal or the need to taper is whenever we don't listen to what is our lowest effective therapeutic dose and we want more, 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 more. And it's like, come back to what your intention was. Use this mindfully because that is where it can be safe and effective. Like there's no reason for people to have to take this every day. I mean, we have people who have chronic pain who are doing perfectly sustained doing it every other day.
Mm-hmm.
That's my 2 cents on it though.
Yes, and there is a tolerance that can build, and a cross tolerance with some other substances too. So that's why lowest effective dose, which is going to be different for everybody. Sorry, go ahead, Ariane.
Oh, it was something about weight. Like I haven't seen this like weight being necessarily a big issue. People who, I mean, are just more sensitive to things are more sensitive to things. And I don't think that size really has much to do with it. And that's what they've seen in research too, I do believe. But everybody's like, I think gut health has more to do with it than weight. Like, what's the state of your gut? So
Right. And also I think a big part of it too is like being in tune with your own brain and your own body. Sometimes men tend to be less in tune with what's going on than women, so they might need like a higher dose to feel something, whereas women, we're just more in tune with what's going on, so we can pick up on smaller changes. And that's like anecdotal. I don't know if other people notice that too. Are there any other last questions, concerns? Personality disorders?
yeah,
I'll
so
let you
like
take that in.
multiple personality disorder. Like if someone has multiple personality disorder, we've worked with people with bipolar, and the question that I ask with that primarily is like, what is their history? Because a lot of people with personality disorders that have been diagnosed as bipolar, like in my personal, I don't think that they have bipolar. I think that it's a misdiagnosis. And so one of the things that I always ask is like psychedelic history. Like, have you ever, what is your relationship with cannabis and all of this stuff too? Because oftentimes those people have already used those things and can give you insight on how it has affected them. If it's someone who is like never used it at all, they're on meds, like it might not be appropriate because what if I mean, it's like open for discussion, right? But schizophrenia, um, and multiple personality disorders, borderline personality is like I said, I mean, and bipolar, those to me like deserve a little bit more investigation and a little bit more questioning and a little bit more care because oftentimes it is an exaggerated diagnosis and oftentimes these people are already doing things and have safely done them. So really takes some
Can I
questioning.
chime in?
Yeah.
Can I chime in on the
Yes.
BPD? So I have BPD, woo, woo, BPD, and it's totally what you're talking about. BPD is actually behaviors that we can adjust. It's a lot of different behaviors that you can fix by learning different skills. And microdosing actually has helped me personally really become undiagnosed from BPD because I don't have any of those diagnosable traits anymore, which is really interesting that you can kind of become undiagnosed. And I think the same goes for borderline or bipolar because it's an energetic. When you start to learn how to manage your energy, like the highs and lows, then it doesn't become so pronounced. So those symptoms don't really fall under the DSM-5 anymore. And I really believe that it helps with reducing chronic suicidologies and the thoughts of being very low comes with being borderline. And that has really gone away. And I wouldn't have done Modern Nurse Fest if I didn't microdose. So that if that's not a testament, I don't know what is. But I'm a better parent. I wasn't a very good parent when I was BPD and deep in that. And microdosing has helped me become more patient and just brush off the things that really used to irritate me. So it helps me eat better. I mean, there's so many different things that helps with the BPD diagnosis. And I actually have a lot of clients that have the BPD diagnosis and eventually become kind of undiagnosed because it's a behavioral personality situation. It's not like you're not multiple personalities, it's behavioral. Same with bipolar. So that's just my 2 cents from personal experience.
Thank you. Thank you for sharing.
I think the most important thing with people who have personality disorders that are looking into this is like being fully supported because it can cause mania. It can cause like deeper depressive. And I like from my personal experience of working with someone with BPD and anxiety, that was a presentation. It's like, I'm anxious around work. I'm all these other things. We got the anxiety under control. And then he like fell into a deep depression and was like super sad and didn't want to get out of bed. And it was just like, let's have a conversation. Like, let's adjust the dose. So that's what we did. But he had every reason to be sad, y'all. Like there was some things going on with his kid and his family. And and it's like, okay, let's talk about some tools, right? This is an opportunity to go into therapy, right? You are in this different space. Like, how can we get traction and like a space of acceptance and just not feeling defeated with this, right? So having support when doing this really can help people, especially if they're understanding the need for these behavioral shifts and these emotional resiliency that comes online. And I'm not a therapist, but it works really great with therapy. And it helps a lot with the sense of self. And that's what I tell people too. It's just like, this is like a welcoming back home to self. Like in a way, like this is a part of meeting yourself where you're at. And I was told by one of our clients that was just too crunchy. You said that it's so crunchy. And I was like, too like hippie-ish. And I was like, well,
Yeah, I may have said that.
way to share this. And he was like, honestly, that's the best way. I don't have any other things to say. Like what you say with it just helps you come back home to yourself is the answer. And I was like, okay, then come sit with me on the grass. Let's get high. Just kidding. But yeah, it does increase sense of self.
Yeah, and I'll say too, like as a business owner, growing a small business from scratch, like microdosing has helped me get out of my head and get out of my own way so that I can do things that I normally wouldn't have done. Like the content that I post. Some of it is kind of out there. Like I'll post videos of me dancing on a pole for my business. And like just microdosing has helped quiet that voice that says that's not a good idea. People aren't going to like that. You know, microdosing just quiets that down so that I can move forward. And the things that I have done, the cool shit that we have done as a business, like has been a direct result of just like getting out there and microdosing, getting out of my own way so that we can move forward as a business. Because it's hard, especially when you're working with substances like this. You know, we're not working with lion's mane that you can just like sell, right? This is like very different and it's a challenging space to be in, but being able to like get out of your own way has been really, really beneficial. And it's 10 after. Are there any other questions, concerns? I don't know, the sharing EMAC, any input you guys want to say?
Yeah.
I'll just say, good job. Great job.
Thanks.
Yeah.
Thanks for
So good. Yeah.
really appreciate it. If y'all know,
Yeah.
y'all have other questions, share the word with friends.
Yes, awesome. Yeah, sign up for the microdosing course. Of course, it's discounted for Modern Nurse Fest participants only. So get in while it's hot and get yourself to feeling better. A lot of us have experienced that in here, and we want you to be your most authentic, best self. And this might be a way for you. So look forward to hearing more about it. And thank you so much for coming. And on to the next speaker. I'll see you in the other Zoom. Thanks, guys.